It is a horrible thing to get people thinking, oh, if I get mammograms, I'm going to get all this radiation and it's going to cause cancer. About 80 to 85% of women that are diagnosed with breast cancer do not have a family history. So, in essence, there's an article that was written in 2020 November, and then there was one that was, I know, it was updated January 24, 2025. And this hurt my soul. Step into the illuminated dark room where I shine a light on breast-related topics and beyond. I'm Dr. Ify McCurley, a general radiologist with over 20 years of experience in breast imaging. In this podcast, we'll explore the diverse and unique patient journeys, share insights, and empower listeners with knowledge. Join me as we dive into candid, real conversations that illuminate the path to better breast health. Leslie Bangamba, how are you, my love?
I am good. Tired, but good. I'm mama 3.
Well, yeah, I know. I saw your post about taking care of a newborn. I'm like, listen, being a mama is hard work.
I was so humbled. I really thought like, oh yeah, I can do this. I've done it 3 times. But with the youngest being 6, I was very humbled.
Yeah.
Because I went to bed, I'm not kidding. I went to bed, I think I'd been burped on at least like 4 or 5 times. And I went to sleep. I was so tired. I just passed out. I was like, I just want to rest. I want to close my eyes.
Yeah, I know. Listen, my husband stayed home, right, and did the kid thing, and very hard. That's a whole other conversation that we need to have to support men that stay home, honestly, because because they don't get given enough credit. But
he was doing it before it was, I don't want to say trending because trending's not right. I don't want this to be a trend, but he was doing it before it was even an open conversation. Like people were having these conversations.
100%. Awesome. Okay. So we're here to talk about a bunch of things. Breast cancer related and then more. Okay. But so before we get into it, let me just introduce you first. Okay. Leslie Bangamba is a mother, child safety advocate, and content creator whose advocacy began after her daughter, Amelie, nearly died from swallowing a lithium coin battery. Determined to prevent similar tragedies, Leslie uses storytelling and digital platforms to raise awareness about battery safety and child injury prevention. She is a writer and executive producer of Amelie's Second Chance, a heartfelt documentary sharing their journey. Through her work, Leslie transforms pain into purpose, driven by gratitude and a commitment to creating a safer world for children. Thank you for being here.
Oh, thank you for having me. It's how I met you.
Yes. And you know what? Like, we should talk about how we met, right? Do you remember?
I do, of course. How could I forget? It would have been around this month, actually.
Right?
Yeah.
Yeah. At the Women in Wealth Gala was last year.
Last year. Yeah. It was last year.
Yeah. Like, it's just like that. We were meant to be.
There was a synergy in the room, and I was just, and somehow, as soon as you told me what you do, and the awareness you do about breast cancer, I was like, oh my gosh, this is amazing. Like, yes, tell me more.
Yes, no, we are definitely soul sisters in so many ways. Like, and then we started talking about. I know you sent me this post that was circulating about Ananda Lewis about breast cancer, which the whole world, was privy to because she shared her story and her experience and everything, which I think it's good in the sense that when celebrities are affected by certain things, they share. But at the same time, I feel that with a lot of responsibility comes, well, when you're in a certain position, it comes with a huge responsibility, right? And we have to be careful about what we say because people hang on to our very word, much like, you're a professional in your own rights. I'm a professional in my own rights, and people are hanging on to what we say. So I think that we do need to be careful about what we put out there into the world, right? So
absolutely.
Yeah. So that's why I thought, we were kind of going back and forth texting. I thought, let's just talk about it. Let's talk about this openly.
I'm so happy you were willing to talk about it because ironically, her story that caught my eye was her. I think there was a story about her saying, I kept my tumor. And that was what caught my attention.
Yeah, for sure. And, I've listened to, I'm just trying to find this post where she did it, but I listened to her a podcast she did under the auspices of, it was Sharon, I want to say Sharon Steve.
Shannon.
Shannon, yeah. That
Yes.
was from 90210. And she did that podcast, which I think it was titled something about talking about breast cancer. Let's talk about breast cancer clearly, something to that effect. Don't quote me.
Mm-hmm.
And then she also had two articles in Essence magazine. And those magazines are, I mean, obviously they're black, about black women, right? Like in very, what's the
Your
word?
target audience is Black women.
Is black women. That's the word. Yeah, target audience is black women. So I mean, I feel like it's super important that what we put out there is right, because as the target audience is black women, we know that even though the incidence of breast cancer is lower in black women, the mortality is higher by the tune of 40 to 44%, depending on what reference you're looking at. So I just felt that it's important that what women read out there, especially black women, it should be accurate, right?
Not just accurate, but just to what you said about her being a celebrity, her having a platform.
Yeah.
We're gonna dig into it, and I had a chance to listen to that podcast, um, and I have mixed feelings about it.
Me
Um,
too.
so my mixed feelings about it come from one point from the advocacy lens. I'm so happy she's talking about it because I
Yes.
feel that culturally, I feel like we've been trained to almost when you're going through something, you keep it to yourself and you struggle alone and you don't build that community. And
Hmm.
if you are a believer, well then you just leave it up to the, to prayers and just keeping it to yourself and just battling it alone. And
Yeah.
I'm so happy she decided to use her platform to talk about it
Right.
because um she's not much older, like she's probably a couple of years older than I am, so
Yeah.
it speaks to me, especially as a mother,
Right.
especially as like with three children, right? She
Hmm.
talks about how her goals are essentially like right now she just wants to make it to her son's high school graduation,
Yeah, that touched me.
you know.
Yeah.
On the flip side,
Hmm.
where I struggle with how she talks about the process is when she's saying, um, and if you listen to the podcast, right, don't quote me, but I'm not saying it verbatim, but essentially she says, I found out after I declined the care that was offered to me initially
Right.
when she found out she had breast cancer, that a year later that wouldn't have worked for me.
Hmm.
That line triggered me because people, everyday people like
Hmm.
myself,
Hmm.
who don't have a medical background like you, Dr. Iffy, are going to hear that, read it, and think, well, if I'm sitting in a room with a doctor and they're telling you this is the standard care that we like to do to attack this cancer, let's say if they're at a stage one, let's say if they're at a stage two,
Hmm.
they're going to be like, no, I want to wait. Like they could very well say that. I want to wait a year and see like
Yeah.
what if you're wrong? And they're going to quote someone
Yeah.
who has no medical background. That's her
Yeah.
lived experience.
Yeah, and that's why I thought it was important to do this, because like you said, yeah, what her words carry weight. And I'm always amazed when people that have no medical background put out into the universe things that are medical that other people will hang on to. So I mean, she's a VJ,
Mm.
and listen, I'm a spin instructor, so I could sit out here and say, oh, I know a little bit about music and DJing. I would never put out there anything that other people should hang on to, because listen, don't do it. Don't believe anything I say about music, because that is not my specialty. You know what I mean? So yeah, I laugh about it, but it really is not funny. That being said, this is not about judging her. Everybody's entitled to whatever they want to do. And, we have people that come to the clinic, and if we offer them what we think is best for them medically, right? But at the end of the day, nobody's forced to do what they don't want to do. Our health is our responsibility. And you go to people to give you direction. At the end of the day, you get to decide, do I want to follow it or do I not want to follow it? So I definitely think that there are things that she did that are her call. And at the end of the day, there are some things she said that I just love that she said, actually, at the end of the day. But there are also some things that she said that I feel need to be corrected, you know? So I thought we
Absolutely.
should start by kind of listening to this post that you sent, right? So people just kind of hear, what she
Have some
said.
type of context to what we're talking about.
Yeah, exactly.
Mhm.
So this is the post people were kind of sharing.
Recently, Ananda Lewis shared that her breast cancer has spread after she decided to keep her tumor as opposed to having surgery.
I felt like my body is intelligent. I know that to be true. Our bodies are brilliantly made. They know what they're doing, and we mess them up, whether we know how that we're messing them up or not. I decided to keep my tumor and try to work it out of my body a different way.
So instead of surgery, she opted for homeopathic remedies, medication, radiation, better sleep, and diet. Now, the reason why her cancer was not caught sooner is because Ananda refused to get mammograms.
For a really long time, I have refused mammograms, and that was a mistake. I watched my mom get mammogrammed for 30 years almost. And at the end of that, she had breast cancer. And I said, radiation exposure for years, breast cancer. Yeah, I'm going to pass. Thanks anyway. I am stubborn. I'm going to admit that up front. Those of you who know me know that's true. And I stand by that thinking. I stand by the research that shows that an accumulation of radiation in your body can cause cancer. And here comes the but. But what I didn't understand and what I need you to understand, the reason I'm here telling you my business is because if I had done the mammograms from the time they were recommended when I turned 40, they would have caught the tumor in my breast years before I caught it through my own breast exam, self-exam, and thermography. And they would have caught it at a place where it was more manageable, where the treatment of it would have been a little easier. Instead, what I'm dealing with is stage 3 breast cancer that is in my lymphs. I need you to get your mammograms.
I don't think anybody should judge Ananda for her decision to not have surgery. Cancer is hard. The treatment options have risks, side effects. They are not 100% effective for everybody. What I will say is there's a broader issue where people don't trust doctors. People don't trust medicine, technology, vaccines, science. The reason why I became a doctor is because I want to help people live longer, healthier lives. And it's my prayer that faith and trust in doctors and medicine can be restored.
So that was Dr. Robert. So we'll give him some props to Dr. Robert for posting. And I know a lot of people posted that too. So that's the post. That was the whole to do. And I just thought it was really interesting that she started by saying that our bodies are intelligent, right?
Mm.
I thought it was really interesting because a lot of, especially Black people, let's be honest, are people of faith,
Mhm.
are people that believe in God, people that believe in creation. And she said, like, we're the ones that mess it up, right? So in that regard, I think to myself, if we're made in such an intelligent way, don't you believe that our bodies are also capable of regenerating and repairing themselves? And I say that in terms of this whole thing about radiation that she mentioned. Now, a lot of people may or may not know this, but the dose of radiation that we're talking about for mammogram, it's so low. Like I pulled out a little chart here. Let me see if I can find it.
I'm excited that you're bringing this up because you're going to share the dosage. But I had to even learn this for myself, right? This is why
Yes.
I love that you have mentioned at the beginning. This is not to judge her decision, it's to create a discussion around what she's sharing because the amount of MRIs and CT scans that my daughter personally has had to go through, I remember I had to sit down and ask a doctor, okay, I'm really concerned. Like, what are the pros and cons to this? Right? I feel
Right.
like she's had too much exposure.
So the thing is, so a mammogram exposes a woman to zero point 0.4 millisieverts, which may mean nothing, but comparatively, if somebody goes to get a chest x-ray, it's zero point 0.1 millisieverts, okay? And that zero point 0.4 millisieverts for a mammogram, it's equivalent to about 7 weeks of background radiation.
7 weeks of
Of
background.
background radiation. So every day, we get radiation from the background, right?
Okay.
If you fly, you get radiation. It doesn't prevent people from flying. The radiation is actually higher if you live in a place that has higher altitude. So if you're living in, say, somewhere like Colorado, the radiation is going to be higher, right? So that's zero point 0.4. It's so low.
Yeah.
Yeah. And, if you think about it, if it is really that we're accumulating radiation and we store it and people are going to get cancer, then technically everybody should be dying of cancer. That's not what happens. I am not saying that accumulating like a lot of radiation won't predispose you to cancer. Yes. But we worry about that more so in younger people exposing the breast to radiation. So like 20 people that are say 20 years and older and younger,
Okay.
which is why screening is not done routinely in people like this, right?
Mm.
So she talks about this and then she talks about her mom after 30 years getting breast cancer. Well, there are a lot of people that die and don't get breast cancer. Who's to say that's what caused it?
And I should note because she's talked about it in like on different platforms. In the
Yeah.
podcast, she mentions that her mom did get breast cancer, but it was detected early, Ify, which is what you advocate for.
Yes.
So if her mom had not had those mammograms, how would they have detected? Because she was detected, I believe it was like a stage 2.
Ananda?
Ananda's mother, yes.
Oh, yeah, yeah, yeah. Oh, I'm not sure if she mentioned the stage. I don't actually really know, so I can't quote about that. But it was early.
It
It
was
was
early
early.
detection.
It probably was earlier than stage 2. But it was earlier, definitely, than when she got detected, right?
Mm.
And so I think it is, me, I'll just say it. It is a horrible thing to get people thinking, oh, if I get mammograms, I'm going to get all this radiation and it's going to cause cancer. Here's another reason why. If you do get breast cancer, you're going to have to go through staging. So,
Mhm.
staging, if you're going to do, say, like a CT, chest, abdomen, pelvis, as an example, it's roughly about 10 millisieverts. Remember, I told you a mammogram was zero point 0.4.
0.4.
One CT, chest, abdomen, pelvis, is about 10 millisieverts. That's a lot.
Mhm.
Not to mention the chest x rays, not to mention you're going to do a CT chest, and it's not going to be just one. Now, comparatively, she actually mentioned that she ended up having 2 PET scans. One PET scan is about 25 millisieverts. The annual dose that's allowed for somebody that's like works in radiation is 50.
Wow.
So you're there. And all this could have been prevented or at least minimized by just getting that yearly mammogram and allowing our body that is created so intelligently to do its thing. There's
Mhm.
radiation in the food that we eat, right? And so when I see this, and the sad thing, and much like she did, over and over again, I see this, oh, I wish I knew, I wish I knew. It's the after the fact story. And that's why I'm doing this. It's because it's nice that you're doing this after the fact, but you've put it out there and people are going to hang on to that.
Yeah. I think what in having this conversation, let's demystify or let's make some corrections to what was said because I think people need to hold space that that's her lived experience, but these are the facts of how it should go, especially and again, no fault on her because you only know what you know. With her sharing that her mom had breast cancer before, I mean, I know at least for myself, if a member of my family has had breast cancer before with a direct link to me, my grandma, my mom, my sister, I should probably get checked, right? Because that's a familial trait. So I feel for her because she was misinformed. All right, just even in her being against a mammogram. Now, I've already had a mammogram. They're not that comfortable, but they're also not as painful as they're
Oh
made to
God, it's
be.
painful. You know what? So you said a few things. Mammograms, yes. Let me just start with that. For some people, they are painful, especially if you have fibrocystic breast tissue, but it is momentary. It's such a
And they move your girls around. You're not going to be stuck in that position.
yeah, and you have control. We actually have a machine where you're given the button and you get to, remove or add the pressure that you want.
Okay.
It's in your control, right? And I always tell people, don't come during your cycle, take a Tylenol if you're prone to pain, but it's really not worth it to avoid it and be diagnosed later. Because the one thing, and I actually say, first thing I love, 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 love that she reiterated is early detection. And she pushed mammograms. So at the end of the day, she mentions in the podcast, I think it was on the podcast where she said that she kind of mentioned that she wanted to keep her tumor. It was a tongue-in-cheek comment, and then it sort of, exploded. But, whatever. Tongue-in-cheek, it didn't come off that way when you kind of listen to what she said. And it's so people hear that and believe it.
Yeah. And that's what is so like she does, I will say, after like watching the videos that I have watched about her speaking on this, listening to the podcast, she is advocating
Yeah.
for the bigger picture to what you talk about all the time, which is early detection.
Right.
And not just getting it detected, but early detection and doing something about it.
Yeah. And something else you mentioned, she had this history in her family. Now, another thing that most people don't know, because I see it all too often, where women, when they're diagnosed with breast cancer, they be like, oh, or if there's something like, oh, I'm not worried, it's not in my family. Breast cancer is one of those unfortunate cancers. About 80 to 85% of women that are diagnosed with breast cancer do not have a family history.
Wow.
That's a high number. So if you actually do have a family history, it elevates your risk. But most people don't have that history. So being like, oh, I don't have a family history, I'm cool. No, you're not cool. And I worry about that, knowing that, right? Because 1 in 8 women will be diagnosed in their lifetime. In Alberta, it's actually 1 in 7.
That's so high.
Right? It is high. So there's really nothing I say there's nothing we can do about it. There are measures we can take to improve our odds, which again, I want to come and talk about that later. Mm-hmm. But your best defense is just early detection. And the only way we're going to do that is through mammograms. Because mammograms, so breast cancer, when you detect it early, it most often presents as little calcific specks, so little white dots. And we are trained to have the expertise to look at it and be like, okay, yeah, these are benign or not, or we can follow them. You're not going to see that on an ultrasound that early.
Okay.
I mentioned that because, again, a lot of women come in and be like, I want to just have an ultrasound. I don't want to have the mammogram. Because, why? They're afraid of that radiation.
Not knowing how the levels work.
Exactly. Now, by the time we see it on an ultrasound, it's now a mass. And it's no longer stage 0. Yeah. So if you've heard of something called ductal carcinoma in situ, that's a precancer. It's stage 0. Often presents as calcifications. Usually we'll see that on a mammogram. Ultrasound is not sensitive enough to see it. So those calcifications will they'll keep doing their thing, growing, and then eventually they'll form a mass. So now we're moving now from stage 0 to maybe stage 1, 2, and then we'll see that on ultrasound. So if you don't have a mammogram by your choice, that's fine. We may find something on ultrasound, but it's not going to be stage 0. Most likely, it won't.
I just feel like this type of information, like even for myself, prior to meeting you, I didn't know much about, like, yes, I knew about checking, right? Check, you're in the shower, you're laying down. I knew that, but I didn't realize how much I didn't know about my own health. And I think that leads to, not to change the topic, but it just leads to the bigger topic of how women were not even taught like just very basic things about checking our health. It takes people like you, people like Ananda advocating like, hey, this is what happened to me. And this is now what I'm doing to fix it. Because even she discusses like things to avoid. She talks about, mommy juice, wine. She had too much. She talks about smoking. She talks about diet and movement. And She says all these great things, which
Mhm.
I get it. We hear it,
Yeah.
but it's the fact that, okay, let's say you're not moving your body. Let's say you're doing all the things that she was doing, but if you
Yeah.
were still getting a mammogram, the early detection, you would be able to see early on, like,
Yeah.
hey, you're
Yeah.
presenting with XYZ. I would suggest you, do the following, right? So
Yeah.
part of her advocacy, which I really do appreciate, is, don't wait until you're in my position. Like, make these
No.
changes now, but get checked.
Yeah, 100%. Now, I will mention something that I think she talked about in her podcast. She certainly spoke about it in both of her. She has, so in essence, there's an article that was written in 2020, November, and then there was one that was, I know, it was updated January 24, 2025. And this hurt my soul. She talked about thermography. Do you know what that is?
No, I don't.
Okay. So people want to avoid mammograms. So you go for something that seems quote unquote better, easier, right?
Mm,
This picture, this is a thermogram.
okay.
So she did mention that she did thermography and self checks, right? Thermography is not an FDA approved procedure for breast cancer screening. It's one of those homeopathic things. And how does it work? It works by sensing heat from your body to determine, to say, like, okay, there's heat, therefore this is abnormal, right?
Mhm.
Now, so that would work on the premise that if she has a cancer there, it's generating heat.
Okay.
By the time a cancer generates heat, quote unquote, it's got to be large because that heat is coming from vessels. When you have an abnormal growth, there's something called neovascularization. So abnormal vessels come in and, quote unquote, that will emit heat. That is what a thermogram will do. Now, thermograms are not, there's a lot of false positives. So, meaning that it will say, oh, you have an abnormality and you go get a mammogram. Well, it's not. Or it will say it's negative, but it's not. It certainly won't detect an early cancer. It certainly won't detect calcifications.
What I'm hearing though is, even if you do that, you still have to get a mammogram.
Exactly. So for me, like when I saw this comment about thermograms, I was not happy about it
Mm.
because, like it says here, what about thermography? Due to concerns about radiation, some women turn to thermography. It uses an infrared camera to produce images that show the pattern of heat and blood flow on or near the surface of the breast. It's based on the theory that a temperature change in the breast reflects increased blood flow in the underlying tissues, allowing detection of cancer and precancerous changes. It's been around since the 50s. There's not a single scientific study that has shown thermography to be an effective tool for detecting breast cancer, but she put it in there and it's out there.
What I hope the readers, though, when reading that, I hope that they understand that that was part of her journey, but that's not. I, I really like. I really hold space for her, and my heart goes out to her because I know she shares that as part of her journey. But I just hope, as she continues to advocate, that she shares that although this was my journey, which she is doing essentially, I wouldn't recommend that you go this route. Like, get checked by the way that, especially that so much, like you said, so much studies have been done, like mammograms, how they're done, the type of machines they use. Like, technology just keeps on advancing and advancing and
Yeah.
advancing, right? So,
Yeah, like, I found where she said, if I had done the mammogram from the time they were recommended when I turned 40, they would have caught the tumor in my breasts years before I caught it through my own breast exam, self exam, and thermography, Lewis said. And they would have caught it at a place where it was more manageable, where the treatment of it would have been a little easier. Yes, and that's why I said her messaging is mixed. Absolutely. If it was caught on thermography, it will thermography is going to catch maybe something that is like in her situation, yeah, grade 3 or higher. To like more. It's going to be a large ugly tumor that's generating heat. And I've been practicing for over 22 years. Oh my god. And listen, breast cancers are not that vascular. They
mm,
really aren't. So to say that you're going to do a thermogram and it's going to, no, it won't. It is false. You're going to pay for it. And then when something shows, you are still going to come for that mammogram. So I'm not, if people want, like, again, I'll say it again, if people want to do it, you know what? Do it, but go in knowing what's happened. Go in,
And,
eyes open, ears open, understand what you're going for, understand the science behind it and the limitations of the study. Listen, we advocate for mammograms, but we also say mammograms are not 100% effective, especially if you have dense tissue, right? So I'm not here sitting here saying, oh, yeah, it catches everything. No, it doesn't.
okay.
I'm going to tell you the pros, I'm going to tell you the cons. But I'm also going to tell you the truth that thermograms are not it.
And is there any type, like, just curious, because there could be a listener listening to this and really advocate, like, can the thermogram, like, does it expose you to anything? Like, is there still a risk of exposure to anything? Or is it
Well, it
just,
doesn't use radiation. So I honestly, like, I don't really know what the purpose of it is. Like I said, it's something that was originated in the 50s. As it relates to breast, I'm not a thermogram expert. I've seen the reports, and honestly, Leslie, like most of, like over 95% of people that come in with results from thermograms, they're bogus. It's nothing.
okay.
Like, it's nothing. And they've paid for this. And on the other hand, I see a lot of women that come in with breast cancer and they'd be like, oh, I had a thermogram and it said it was fine, but it wasn't. Like, that's just the truth.
Mm,
That's why we do this. That's why we talk about it. We can't prevent people from doing what they want to do. But the truth is, when it happens, you're still going to come and see us. And that's why I had made a post saying, there's a lot of talk about women and power to choose. And I just want to empower women to choose to go early. Because regardless of when you choose to go, if you choose to go late, you're still going to come and see us.
yep.
And I did this podcast with a surgeon, Dr. Paris, and I said, how many people have you operated on without a mammogram? He said, maybe one, like for an extenuating circumstance. So we need a mammogram. Surgeons are going to need a mammogram to get a picture of what's going on.
And even to just figure out what kind of treatment they're going to have for you. Like, where is it? Which part of the body is it being affected in? And I think um just like the video that you played, just to show the content, so that the viewers can know what we're discussing, there's just a big, and I think at the core it's just like women not being properly educated about their bodies, but also I just feel like has a community, the world, there's like this lack of trust between physicians and their patients.
Yeah.
And what can we do to bridge that so that
Why do you think that is?
um well, so many reasons. I like to apply the 80-20 rule. I
Okay.
think for people who might have had a negative experience with a doctor who maybe shouldn't have been a doctor,
Mm-hmm.
and they got a really loud mouthpiece
Mm-hmm.
and share it. I think coming from the lens of a Black woman, I think when you look at the history of medicine and how it's treated Black people, it does leave room for a distrust. Just look at the creator of gynecology, right? Right? So, and you can Google that, look it up, you'll see the history. So I think depending on how you show up in the world, it can come from mixed things. And I also believe that people are getting a lot of their resources from so many different places, and it's creating a confusion.
Yeah.
I know for me, I always give that disclosure, which I will say Ananda does do that, but I do not have a platform like her. Right, she has a
Platform.
right? But for me, even when I raise awareness, I'm always telling people this is my story. If you have
Right.
questions on what to look for,
Yeah.
talk to a doctor, because
Mm-hmm.
a doctor will have seen different cases about how a child presented with
Yeah.
a lithium coin battery. I
Mm-hmm.
don't know my experience, right?
Mm-hmm.
I advocate to educate, but when it comes to um, something finite like medically, I always make sure there's a doctor to talk about that because I don't have that background.
Mm-hmm.
And I think people, it's great. Like, I love being an advocate, but I'm not a doctor.
Yeah, but yeah, no, for sure. Like, you've kind of gone through it, and I do want to definitely talk about that before we sign off. What saddened me in a way with her is exactly what we're talking about. She's had people in her family, so she's seen her mom go through it. And she then mentions when she got diagnosed, that was the time when she decided to now look into why cancer happens in the body. I don't know if you've ever heard of people talking about if you have a UTI, like to prevent a UTI, cranberry juice. Have you ever heard of that?
No.
Okay, yeah. So there's this belief, and maybe true or false, I don't know. Listen, like she says, I believe our bodies are made in a very intelligent way. I believe in God. I think that, there are a lot of plants, fruit, just healthy living that helps boost our immune system, right?
Mm-hmm.
So maybe there is a way that cranberry juice helps with the bladder health and all that, right? But if you have a bladder infection, that is not the time to start taking cranberry juice. Okay?
You
Because
need to nip it in the bud.
we've passed that point. Exactly. This is not the time. It's before. When you now have that UTI, you're going to go see a doctor and get put on antibiotics. Otherwise, things will progress. Then you get a kidney infection, you could get an abscess, like you can go to town.
Yeah.
So to me, that was not the time to start that research. Again, everybody's going to do what they got to do for them. And I believe it was in the podcast where she said that when she eventually went on to whoever was treating her, and she said that they reckon the chemotherapy that they were going to recommend for her was like third from the bottom.
I don't even know what that means when you say third from the bottom.
Well,
Like,
the way I understood is like so let's say they were 20, they
okay,
chose number 17 for her or something like
okay,
that,
okay.
which doesn't make sense to me. And I cannot comment on it because here's how I like to think about this. As women, like you get pregnant, people want to give you advice,
Mhm.
but every woman's journey is different,
Yep.
right? Like I
Mhm.
can't tell you how your pregnancy, how your delivery day is gonna turn out. We don't know.
You can have more when you have more than one child, your delivery is not even the same.
Exactly. Why I said that is every breast cancer is different. It's unique to the person. The
Mhm.
biology is different. So hence why even me, as somebody that's in this field, I can't comment to that because I would have to see her pathology. I would have to see, was it hormone positive? Was it estrogen, progesterone, HER2, how it was growing? And it seems to me that she was told it was growing moderately because she put it somewhere in one of these articles. And the way she would find that out is there's something called a Ki-67. So we're able to kind of determine, is this a fast growing tumor? Is it slow growing tumor? So it seems like she did that. And there are bunch of, I'm not an oncologist, so I'm not even going to go into that territory, but it is very hard for me to believe that an oncologist would look at all the chemotherapy agents and say, you know what? Number one is the best for you, but I'm going to start you on number 17.
Mm.
Do you know what I'm saying?
But okay, I hear what you're saying, but and not defending it, but it does bring the other question because in the podcast she does mention when she did start treatment, not the original one presented to her in Arizona, she couldn't continue with it because she didn't have money anymore and insurance is not going to cover certain things.
Exactly.
And of course, we're Canadian, so I don't know what an American healthcare system looks like, right?
Yes.
And so to what you said, like we can't really speak on it because we don't know her pathology.
Yeah. We're Canadian, which definitely has its advantages and disadvantages healthcare wise. But
Mhm.
what I will say about her care is when you look at it,
Okay.
and she even commented on it. And there's a lot of pages. I don't mean ruffling, pages. So she didn't do what she was supposed to do at the time, but then COVID hit. Then she drove 419 miles where she went to Arizona because apparently Arizona during COVID was like COVID what? Like so they weren't
Yeah,
really adhering to
that's
whatever.
exactly what she said.
Yeah, exactly. So she did things like cryoablation, an FDA approved procedure that injects gas into the tumor to kill the cancer cells by freezing them. She did genetically targeted fractionated chemotherapy. She did apheresis. She did all these things. And at some point, I think she even did like a hyperbaric chamber. Um,
Oh,
yeah, she did all these things. And I also think it was in the podcast where she mentioned that it was to the tune of about $78,000. And
yes,
she only got $6,000 back. You know what? Not a lot of people have that luxury.
true.
Even here. Even not a lot of women have that luxury to have people to pay for things like that. So while you're saying that you did all these other things because you didn't want to go to conventional medical route, not everybody has that luxury. $78,000.
That's
Do
a
you know
lot of
what
money.
a privilege is here? So have you heard of 3D mammography?
No.
Okay. So back in the day when I first started training, right, we used to do just film mammograms. So the tech would take the cassette and we have these films, like a chest x-ray, and we'd hold it up to the light and try and see things. And we did our best. It was hard, but we did our best, right? And then eventually we've now gone from, so we call that analog to digital. Most things are digital now, right? So
Mhm.
now we sit on computers and we look at things, and it's much better than the film stuff, right? The detail
Yeah.
is great. But we've progressed even more. And now we do a 3D mammogram where it's kind of like we're taking thin slices of the breast tissue and we can see through it even better. So even if you have the limitations of, say, dense breast tissue, with the 3D, we can see a lot better. In Alberta, pretty much everywhere does 3D mammography.
Okay.
That's not the case in most of Canada.
Oh
So,
wow.
yeah.
Okay. That threw me for a loop.
Yeah, like not everywhere in Canada has 3D, mammography. So we're pretty privileged here, right? And
Yeah.
also another privilege we have in Alberta is if your breast is dense, so at least like category D, C, a screening is added on, supplemental screening. Not a lot of places have that.
And when you say supplemental screening, is that like another mammogram or is that an ultrasound?
That's ultrasound,
Gotcha. Okay.
right? That's ultrasound. So, we say the limitation of mammogram is, so on a mammogram, if you have a cancer, it's going to be white.
Mm,
If you have dense breast tissue is white. So white on white, it's a masking effect,
mm,
right? So it's not like useless doing a mammogram, but there are some limitations.
okay.
And so in Alberta, if I have somebody that's a D or an extreme D, I'll add an ultrasound onto it. And I can't tell you how many cancers I've picked up that way with category C and D because it's masked.
Wow.
Yeah. And if we don't do ultrasound with a handheld, so a lot of people know what a handheld ultrasound, when you get pregnant, you have a tech that's scanning you. We also have a technology called ABUS, which is automated breast ultrasound. Like it's made by certain companies, so it's marketed as ABUS.
Mhm.
And it's where somebody's holding the machine and scanning. The detail is amazing. We've picked up 4 millimeter cancers that way. We have that here, so lots of advantages. My sister in the States had a mammogram. She was a category C, high C, they told her. But in order for her to get an ultrasound, she actually sent me the text. They told her, you can get it, but you'd have to pay out of pocket for it.
Wow.
So we're doing okay here. And that's why it pains me that with everything that we have here at our, like, just given to us, we still, there are people that don't take advantage of it. Again, that's their choice. But listen, I'm also coming from a place, a third world country. I'm African, right? And we know that there's a lot of women out there that do
Mhm.
not get to have this.
They die without even knowing that they had breast cancer.
Yeah.
And then coming from I'm a first generation, I'm born in Canada, but coming from a Congolese background, and then you
Mhm.
say, oh, it was witchcraft, it was,
Yes.
and it's like, no, they don't have the privilege of being able to get a mammogram. And if they need to get an ultrasound, they don't have that privilege.
No. I was actually talking to a radiologist in Nigeria, and I'm trying to arrange to see if I can do a podcast with them. But a lot of places don't even have. So if we see calcifications on a mammograms and we think they're suspicious, we can biopsy it to see if it's stage 0. In which
Mm,
case, then we'll go ahead and refer them to surgery and they'll get it taken out. They don't even, a lot of places don't even have that technology. So they have the technology ultrasound, which, as I mentioned to you before, by the time you see it on ultrasound, it's now a mass, it's now higher stage, right? And just back to Ananda, that, so she started off as stage 3. the higher the stage, the lower the survival rate. Pretty much, if you have a stage 0, it's almost 100% survival.
I think these conversations are important. Even the conversation she's having, it's important that she's having that conversation, but I think it's also important for these type of conversations to occur
Yeah,
because you know you don't want and that's the thing, right? People are going to take what they get. I truly do believe that her reason for talking about it is noble, um
100%.
because she's now stage 4, right?
Yeah, she's stage 4. And, I'm a little bit confused by that because it seems that, I'm looking here in her Essence article. She says, I'm eternally grateful to the heroes in my life who made it possible for me to survive. I never could have carried the financial weight of this by myself. She's a single working mom. Insurance doesn't cover most of these treatments, all the stuff, right? And then it seems like she said, so she did all these things. She finally got her insurance back. She had a scan that showed everything was still stable. The tumor was a little bigger, of course, because you know what, Leslie, I'm yet to see a tumor that is stage 2 or 3 that regresses on homeopathic means. I just haven't yet to see it, and I'm not God. I don't have, we are doctors. We don't have that lens. Tumors grow at different rates. There may be some that grow faster. There's some that grow slower. So there may be a period of dormancy where things are stable and eventually things will start to pick up because after all, cancers are abnormal cells that grow crazy, right? So they're growing. Whether they're growing slow or fast, that's their own rate. So now she says the tumor was a little bigger, but it hadn't spread anywhere. So she felt really blessed, right? And then she went with a different route with electrical ablation. And she said she went to see her American doctor in Mexico. And then I think, I'm not really sure what happened, but then she said, I could feel things happening in my body that didn't feel right. I didn't know what was causing it. Was it ablation procedure? The radiation that PET scans expose you to? The shift I've made in my diet to try an all food approach? No one knew. But then she had a PET scan in October 2023, which showed that the cancer had gone wild in her body. It had spread to a site outside the original location that put you in stage 4. So then she went to stage 4, right? And man, all too often I hear stories like that, and it makes me sad. It really does. Because I will agree with her. You don't know what path you take that may eventually put you into stage 4 anyway. There are tumors that are super fast growing, like I know, people that were 24 and diagnosed and passed away, and people that were 24 and diagnosed and are still here. I remember one of the doctors that I worked with, I mean, she was in the hospital. She had access to the best of the best, but she still died of it. So everybody's tumor is different. But I just feel like you give yourself the best chance, and that to me is what I know as the best chance. And if homeopathy, whatever, like the doctor said in the post that we listened to ahead of time, that's what you choose. That's you. But I just don't want it out there as that is the right way.
And um I think to your point, and please correct me, it's like you're just encouraging people to really explore other options. You're not bashing homeo. I think it has its place for certain things.
Yes.
When you're at a point where it's life or death, you want to attack so you can live.
Yes, that is absolutely what I'm saying because I believe in a holistic approach to life. It's not all about medicine and poking
Mhm.
and prodding. I think there's more to it than that. Chinese medicine has been around for years and years and years and years, and I'm not a homeopathic doctor. I'm not a naturopath, but I'll even tell you, I have explored some options at some points in my life,
Mhm.
and it's not worked for me
Mhm.
with the best of intentions. Like, so my mind is open. But I'll tell you what, if I'm diagnosed with cancer, God forbid, this will not be the time for me to be exploring that. I want to go with something that I know there's science behind the treatments, not something that is a not for sure.
And I think what people should remember, and she does highlight this, is 4 out of the 7 women that became her friends, they all passed away and they went the standard route of care.
Yeah.
But the thing is, a doctor's role is to guide you, right? Just like you said, they will never impose something on you, but they
No.
will guide you. based on the statistics, based on what they see, people they've treated. I think what people need to remember is a doctor is trained in their specialty, but nothing is definitive, right? But they can give you that information that will best manage what you're going through. And just like any type of treatment, they will change the care if it see that it's not effective.
Exactly. Yeah.
Right.
And that's why when people come and ask me, oh, like, what do you think's going to happen to me? Are they going to, take this breast? I'm like, listen, I'm not an oncologist. I'm not a surgeon. I'm not going to go there. Now, the way she kind of words it is like, doctors are too scared to say. It's not that I'm too scared to say. It's just that I don't think it's fair for me to mislead you. I'm not going to, I'm not going to tell you, oh, you're going to get like 2 rounds of radiation or chemo. How do I know?
Especially when the vicious thing with cancer is it can change.
Yeah.
Cancer is not just one of those things. This is it presents as A. It could present as A and be something completely different. So it's, and I think, I think that's the conversation. It comes down to trusting those who are in place for our care, and for those who are in our care to be able to have those conversations with us. Because I know, for me, when it comes to my own personal care, I know I question my doctor on everything. And when I question, it's not because I don't trust them, it's for understanding.
Which is awesome.
And I think some people, they're questioning, but I don't know if they're questioning to understand, or if they're going in with what their view is, right? And it's like that delicate balance of like, I respect where you're coming from and maybe the stories that have been shared with you, but I am also coming with my lived experiences in this role and what I see.
Yeah.
And it's, again, people can take a story from somebody, but just to your point, I don't know their pathology. I don't know their medical history. I don't know that. I don't know all of that. So you have to almost take, if you're following someone on any platform, take what they're saying with a grain of salt.
With a grain of salt, look at their qualifications. Because a lot of people out there, listen, if you're looking for somebody to say something that will tickle your ears, there are so many people out there. They are there. Okay? They like, you just open up the internet, there are people there. There are people that say they're board certified and they're not. Which is scary. We see things like this more so in the States and Canada, but we do see it. And for me, gosh, I'm a lifelong learner. I'm learning every day. I'm so curious, and I just feel like there's always something to learn and improve on. And we're not perfect. I'm not sitting here and telling you we know everything, but learning is constant. I'm going to tell you what I know is best for you. I have no reason to send you down the wrong path.
And it's not just coming from you, because I know from my lived experience and watching it, doctors will discuss amongst each other, right?
Yes.
So it's not even just, they're going to have conversations with other specialists and be like, this is the treatment that I'm thinking we should do.
Yeah.
Based on your experience, what have you seen? Like, what's the rate of success? What are some, they're going to collaborate.
Yeah. And, it's funny you say that. So when I did this podcast with Dr. Raja, she actually mentioned, if you want your tumor discussed, you can say to your family doctor, I want it discussed in the tumor board.
Okay.
Yeah. And it will be brought up in tumor board and discussed more than one mind, right? I didn't know that actually. So I was like, oh.
I didn't know that either, but now.
So that's kind of cool, right? Like, and I see it done, you sit on these tumor boards and, surgeons or whomever will bring up, I have this case that I want to talk about and see what you guys think. And then, the oncologist will chime in and the surgeon will chime in. And then at the end of the day, okay, thank you for your input. And this is what I'm going to do. Yeah. So that does happen.
Yeah.
Right. And to me, if you get to a doctor that says, don't question me, that is dangerous. Doctors, I want my patients to come and question me.
And I think that's why I apply, I'll say the 80-20 rule, where I do believe that those who, and from my experience, those who work in medicine are there because they want to be there and they want to help you. And I think I haven't experienced it, but I don't know what others' lived experiences where they might have felt that. But we live in a country, you can change your doctor.
Yeah.
You know?
It's not like the States, though. Like sometimes I think in the States, they're like, oh, I picked my treating team. Yeah, we don't get to pick our treating team.
No.
No. It's a
If
little
you're, if
harder,
you're picking your
but
team, there's some serious money there.
oh yeah. Oh yeah. But it does make me sad, especially, when you look at the statistic that I mentioned to you about the 40% mortality in Black women. It really pains me that it's an insurance. Like here, you go for mammogram, you don't think about it. In the States, you have to have insurance to do that.
Yeah.
So is it any wonder that people that have lower socioeconomic status will not go for that? You don't go for that, then when you find your breast cancer, it's going to be more advanced. Duh. Yeah.
Mhm.
Right. And so, yeah, it's kind of disheartening. We don't have that issue here. It's a choice
Mhm.
to go or not. Right. And the other thing I wanted to talk about that she mentions, and she talks about, I think she said that, I kind of wrote it down, and my notes are everywhere. Like the only she said something about prevention. You can't prevent breast cancer.
Mm.
She said something to the effect that she knows that had she
Made better choices. So she does
could have
list like
prevented
all.
it.
Mhm.
Yeah, no. And the reason I want to say that is I don't want to see anybody guilt tripping themselves into saying, man, if I'd have done this, I could
Mhm.
have prevented it. Because if we knew how to prevent breast cancer, I mean, would we have breast cancer or any cancer?
Mm.
We wouldn't. There's certainly things that you can do to improve your lifestyle to decrease the chances, but to prevent it, I no.
Yeah, it's one of those things. It's interesting, and I from another woman, just listening to another woman express what she's going through. I think even when she's is talking about it, she's going through it. So I
100%.
do think some of the things, because she does mention that, and then she talks about how her grandfather was a heavy drinker, right, and his body stayed strong well into his 70s and 80s, right?
Yeah, that's what I mean. Everybody's different. And we just seen the research which she talked about, and this is one of the things I love. She brought out a bunch of things. I think alcohol has been really shown to increase the risk of breast cancer, right?
Mm,
I mean, but people still do it. And she talked about, sleep, chronic stress, poor sleep, which a lot of people. I mean, she mentioned a lot of Black women face this a lot, but I think a lot of people definitely face this a lot. Like, it's just kind of one of those things where I wish I could wave a magic wand and take chronic stress out of my life.
we all wish it, but the thing is, on the flip side, this I do know, our body does need a level of stress,
Yeah,
right? So it's like, where's that barometer
it's
to
good
say
stress and bad stress.
exactly good stress, bad stress? But life will life.
Yeah.
And just like you said, like I was listening to a podcast at some point, I was like, oh my God, my level of stress in my life. Oh my God, I'm not sleeping enough. Oh my God, I love a good donut. Like I was listening to that and thinking like, I am killing myself. And then I had to pause. I
Yeah.
had to pause and go, okay, and even when she was sharing, she's like, I was smoking, I was doing this.
Yeah.
Well, I just know from, I can't remember her name, but bless her heart, she advocated so much, and she was from Alberta. I don't think it was Lois. I can't remember her name, but she was in those commercials where she was showing the hole from.
Oh, yeah.
I cannot remember her name, but she did that commercial traumatized me. I
Yeah.
was like, I'm not
But you
smoking.
know what, though? For all the trauma and all those pictures, has it prevented people from not doing that?
No, right? It will hit certain people. Like for me, it definitely got to me, right?
Yeah.
It definitely like got to me. Like I remember telling on myself, like being 12. I grew up in Edmonton, and you go to movies 12, and there was a group of like the older kids smoking. I'm like, I want to try a cigarette. And I took one puff and I was like,
Yeah.
oh my God. And I was coughing for days. Like my parents figured out that I tried to smoke a cigarette. Embarrassing.
Big trouble.
I was very much in trouble. But between that and then seeing that commercial, I was done, right?
Yeah.
Alcohol, like even when she said she's like, I indulged in way too much wine.
Yeah.
Every different tolerance level. Do I enjoy a glass of wine from time to time? Yes. Is that, podcast gonna make me stop drinking wine? Probably not.
There you go.
But,
You gotta live.
it's yeah.
Yeah. You gotta live in moderation and moderation. She talked about that. Yeah. I'm a huge, proponent of diet, exercise. Honestly, exercise for me is mental health. I have a sweet tooth, so I have to live. We're not perfect. Things are going to happen. I don't know if I could prevent or not. Don't know. You know, chronic stress, she talked about relationship, toxins, household products. Yes. And I think the things she talked about, absolutely, especially us as Black women, she said, the skin, she mentioned as the biggest organ, what we put on our skin matters. All these are hair care products. I've made a post about relaxers, all these toxins and products for Black women that a lot of women are not aware of. And that probably contributes to the amount of breast cancer that we get as Black women. It should be noted, so definitely a lot of wonderful things in what she said, but I had some, things that I thought would be super important to set the record straight. Thermography is a hard no. It's a hard no. Like there's no ifs, ands, or buts. And when you put it in Essence magazine and put it out there for Black girls, our daughters, teenagers.
I hear you. Listen to Dr. Ify. Just say no.
You know what I mean? Like it's like no, like we gotta correct that. And I really wish her the best. And like I said, she really, 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 really stressed the importance of early detection and mammograms, and I love her for that. And I wish her the best. And like she said, cancer is hard. Well, she said it's something hard, but
She used an explicitive.
yeah, it's hard. It's hard.
It is really hard.
Yes. And, I'll tell my patients, I see it all the time, but I've not walked in their shoes. So I can't pretend to know what it's like. So I'm humbly saying that. It's not easy for me to.
The devastation that it can cause, the stress that it, right? Like you have not walked in their shoes, but you are a first responder to it, so to speak.
Yeah.
And
so I can't pretend to know what they're going through. Right. So, but what I can say is I see it time and time and time again, and I have no reason to lead anybody astray. Right?
No, I think for me, like even connecting with you at 35, like I'm learning more about my body as a woman at 35, right? Like, and even now I'm making that decision to learn more about things that are upcoming with my health that I was not taught. So I think there's a lot of, it starts here, like in these conversations, but there's a lot of overhaul that needs to happen in regards to, I think about my 6-year-old daughter. I hope she's like, yes, I'm taking it upon myself to educate myself, so I'm going to educate her. But, I think it should be like in a broader sense. Like we can start just in our province, Alberta. Like what are we in our curriculum? Like, or we're taking health classes, right? Looking at the health classes my kids take, they're taught about their anatomy, and
they teach them about sex, but not about breast self-exams and stuff. You know what I mean? Like, come on.
And it has to be expanded. It has to, that has to change.
Yeah, because we're seeing breast cancer more and more young women. And so they need to be aware that it can happen. It can happen. It's happening earlier and earlier. I just had somebody that was 22, 22 and so we see it. And of course it hits harder when they're younger too. But it does happen. And I consider it a privilege to be in this position, to be able to speak to all women, to be able to speak to women that look like me. Because, I was doing a biopsy on a lady the other day and, we were talking, the text says, "Oh, do you know each other?" It was a Black lady. I was like, "We're soul sisters." There's a connection that needs no explanation. Right? And, at the same time, we live in Canada and I love all my patients. I see every woman the same. But I will say that I also see women that look like me come to me, like you said, maybe it's the trauma from the past where there's an ease.
100. Yeah. Because listen, you might not know me. We might not even speak the same languages, right? Like I'm Black, you're Black. I have a Congolese background, you're Nigerian. But I know when I can express certain things that have been my lived experiences, I'm going to say 7 out of 10 times, even if you might not have gone through it, you've heard it, you're right. So there's a level of that. Like, and when people do, not related to this, right? But I remember watching a reel and it was a Black doctor talking about representation. So one of the patients when we get our hair done, sometimes it's like cornrows are tight. You do this. Now, if you've never grown up around Black people, you
Yeah,
don't know
what's
what
up?
when your hair just got laid, it's it. But the white nurses and doctors thought something was wrong with the
Yes.
patient.
Yeah.
And it's like, no, there's nothing wrong. That's just, I'm
She's
just,
just getting her hair. Yeah.
yeah, she's got her
Yeah.
hair done and I'm padding, but I'm not,
Yeah.
I haven't lost my mental capabilities, but
Yeah.
they actually thought like something
What's wrong with her?
was wrong.
They were going to call psych and put this poor woman away. I know.
Exactly.
Yeah.
So it is important. It
Yeah.
is.
No, representation absolutely does matter. And so, like I said, I consider it a privilege to be in this position, and I'm using my voice more and more. And I'm using my voice more and more now because of what I went through, because of I look this way.
Mhm.
For the longest time, like I've been living less than, because that's just how I was made to feel, and it wasn't enough. And so it's finally like, oh, I finally found my voice. Thank God. Now I can speak, and I'm glad that I can use it to help. I just want to use it to help a, a lot of women to just do what's good for you. The one thing you did mention at the beginning was your handle and where people can go and find that story about your daughter, because I just love, this is, I know I talk about women's health, but I think it's super important. Like your daughter's story, how amazing! Like I watched it and I couldn't stop crying. You know what? This is I don't know if I ever told you this. When I was watching it in bed, and I just started crying. My husband looked at me. I'm like, just let me stop.
Oh.
He's
No,
like,
I'm the definition of her story, and I know people they might listen to this and then go watch it, be like, "How the hell is she laughing in this interview?" You got to find
you
the
gotta
joy,
find a way, right?
joy, and it's one of those projects that, truthfully, I did it because obviously I will talk about it. I think I'll always talk about it. It shaped me. It shaped a big part of my life.
Yeah.
But I could just say, hey, go watch the documentary. Because frankly, there are so many little details and
Yeah.
it's really hard to express in like, an elevator pitch or even like a
Yeah.
1 minute. I can't. There's so many pieces
No,
to it.
there's
So
so many. Yeah.
it was a passion. It was a project that I did just to help alleviate that. I can't like just
Yeah.
becoming a blubbering mess all the time.
Yeah.
So
And and I think I talked to you about this, where I think it was a nurse talking to you. She was a white nurse, and like your daughter was like her daughter.
mhm,
Color
mhm.
was no boundary,
Yeah.
right? And so I feel like, even though we are in a place where, yeah, sometimes color does matter, don't let that be a barrier, because not everybody is like that.
And honestly, like to your point, one of the questions I'm always asked, like, oh, what was your experience like? Like, how were you treated?
Hmm.
And I'm like, I'm not saying this because I'm trying to make the staff or the people that were around me seem better than what it was. I genuinely felt like, of course, I had that, like for myself, you know what it's like going in as a Black woman. I go with my armor, right? And just to think, like, that's so exhausting. Like, my daughter literally could have died so many times, and I still had to put up an armor. That's a
Hmm.
whole other discussion. But the fact that the people that were in our space were there to treat my child
Hmm.
and bring her back so that she could
Yeah.
go home.
Yeah.
That that was what they were there for.
Yeah.
The ones that were parents, they saw a fellow parent. It was not they saw a Black mom. No, they just saw a mom who
Yeah.
loves their kid and
Yeah.
wants to get better.
Yeah.
And
I love that.
yeah,
Yeah. Yeah. So, okay. So we're wrapping up here. Any final words? How do you want to, what do you want to leave people with?
I want to leave people with one. I hope that they have these discussions within their groups because that's how change starts, right?
Hmm.
Have these discussions and truthfully get checked. Like I'm putting my business out there just like Ananda did. I have had breast scares and I was listening to the things that she had gone through and I had stress at the time. My daughter was ill and I'm putting all my energy, especially as women, we put all our energy into
Hmm.
nurturing our families. And if you don't have family, just take women, I just feel by nature are nurturers.
Hmm.
Whether you're a mother or not, I just feel like women are nurturers. But take care of yourself.
Hmm.
Get your breasts checked.
Checked. Yeah. Yeah.
Please.
So I agree with you. Early detection is it. You may not be able to prevent it. There are lots of quote unquote options out there that are not mammograms, but you have to really scrutinize and be like, what are the pros? What are the cons? mammograms are shown, proven to reduce, death through screening, 40 to 44% when you get screened early, and I think be wary of comparing uh, yourself to others, because one person's story or journey is not the be all and end all for everybody.
Mhm.
And to also know that as physicians, we're here for your good. We're not going to force you to do what you don't want to do, but we're here to guide. And I hope that people have faith restored in the medical system, because that's what we are here to do, right? I'm not saying we're perfect or anything, but for the most part, we're here to kind of guide you and look out for what's best for you,
Mhm.
right? So that's what I'm going to leave. And I saw this quote: "It's not what you do for your children, but what you have taught them to do for themselves that will make them successful human beings," right? So we're having this conversation. I like that you brought up, even training our children right from start and having that conversation. And hopefully what we've done now will touch one or two people or three and help make them successful human beings, health wise and more.
Love that.
We'll end on that note.